Welcome to Module 7, Clean Hands Portal, and how to generate a hand hygiene report. At the end of this module, you should be able to access the Clean Hands portal, generate a unit hand hygiene feedback report, understand how to interpret the unit hand hygiene feedback report, and know how to send a Clean Hands report. Use the Clean Hands train icon to access the training environment of the Clean Hands portal to generate your practice reports. Using the training environment will not affect your unit's actual data. Use the Clean Hands icon to access the production environment of the Clean Hands portal. The production environment is used when you want to generate an actual unit report. If you are unsure about how to access the training and production environment of the Clean Hands portal, please refer back to Module 5. If you are a contracted service provider, you can access the portal using an alternate method. This information can be found on the Alberta Health Services Hand Hygiene webpage, detailed later in Module 9. The following recording will provide a tutorial on how to generate a unit hand hygiene feedback report using the Clean Hands portal, and how to interpret the information on a unit hand hygiene feedback report. Once you log into the hand hygiene portal, you should begin on the Reports tab. We will be proceeding in the training environment, detailed by the red bar along the bottom of the screen. The report we will be selecting is the Unit Hand Hygiene Feedback Report, sometimes referred to as the Unit Report. The Unit Report provides information on a unit's hand hygiene compliance. The Unit Report should be provided to the unit staff after completing a review or set of reviews on the day that the reviews were completed. To begin creating a Unit Hand Hygiene Feedback Report, select the link. You will select the demographics for your review by choosing the correct facility, unit, month, and date from the drop-down menus. We have selected the Foothills Medical Center in the Emergency Department in May for this review. Ensure that you are selecting the correct date and time that corresponds with the report you wish to generate. Multiple dates from this audit date category can be selected to generate a single report. This feature is useful when observing in a unit with limited healthcare providers and you want to ensure healthcare provider anonymity. It is also useful when less than 10 observations can be collected during a single review period. By combining several reviews, you can generate the hand hygiene feedback report and meet the 10 observation requirement. Here we have 3 options to select from. Select All, which will select all of the audit dates available, or if you wish to generate a report only from a specific date, you can check off only that individual review. This is a sample of the Unit Hand Hygiene Feedback Report that can be generated using the Clean Hands portal. Hand hygiene compliance can be found in the top right corner of the report. In this case, for this review, it was 65.2%. Out of a total of 15 observations that were recorded as compliant, out of a grand total of 23 observations recorded. In the top left of the report, we can see the demographics of the review that were chosen. At the bottom, where it says Number of Reviews, 2, this is referring to the number of dates that were used to generate this report. In the first bar chart below, we see that hand hygiene is separated by compliance by moment. We can see the different bars for each of the 4 moments. If we scroll down to the bottom of the page, we see our second bar chart, where hand hygiene compliance is separated by healthcare provider group. The healthcare provider groups are divided into nurse, other, and physicians. It is important to correctly identify each healthcare provider into their correct provider group in the Clean Hands system, as the other category shown in this report is further broken down through additional reports available to advanced users. Below our second bar chart at the bottom of the page, we see our definitions table. This table lists the definitions of each of the terms used in the report. It also separates the HCP groups, displaying each occupation and the group that it falls under. At the bottom left, we see a Generated On label. This displays the date that the report was created. At the bottom right, we see the list of pages. We are currently on page 1 of 3. To change the page to the next page of the report, we're going to scroll to the top and move our mouse to the small blue arrow pointing to the right and select it. The second page of the Unit Hand Hygiene Feedback Report expands on the observations that were non-compliant. It includes the comments recorded with the observation to help explain why moments were recorded as non-compliant. It is very important that moment-specific comments are selected for each miss when collecting observations, as these comments will be displayed here. This information is useful for unit staff to understand why opportunities for hand hygiene were missed, as well as for identifying barriers to hand hygiene. This information can be used to determine areas for education and training of unit staff. If comments are not clearly defined or not moment-specific, the report is not as valuable in putting data to action. Each moment is listed separately with the corresponding comments listed below. The first section here will be for missed moments for moment 1. Moving down, let's look at the first missed moment comment below. The number included in the brackets demonstrates how many times that comment was selected for the missed opportunity. Here is selected one time, so the number displayed is 1. If this comment was selected multiple times, the number would reflect the number of times it was chosen. The next number, 1-01, is the Clean Hands system code for the canned comment. After the code 1-01, we see the description of the comment that was selected. Here it says, before patient or patient environment. Staff had contact with the patient's environment after working at the nursing station. Moving down to the next missed moment comment, we see it display, no notes were recorded for these missed opportunities, therefore there's insufficient data to comment on this category. If you see this phrase displayed on your report, this means that the reviewer did not record or choose a comment when selecting a missed opportunity. Ideally, we will not see this phrase on a report. Reviewers should remember to always select a comment whenever recording a missed opportunity for hand hygiene. Scrolling down, let's take a look at our Moment 2 missed moment comments. Looking at the first comment under the Moment 2 category, it reads, Staff accessed and donned PPE after healthcare environment contact. Please note that there is not a canned comment code at the beginning of this comment. This means that this comment was handwritten by the reviewer and chosen as a custom comment. Generally, canned comments are preferred over custom comments. Moving down to the Moment 3 category, we see it says, no misses were observed in this category, therefore we are unable to provide an analysis and a breakdown of this particular moment. This message will display whenever a moment is at 100%, and therefore there are no missed opportunities to comment on. Scrolling to the top of the page, we will now click the blue arrow again to move on to the third page of the report. This is page 3 of the Unit Hand Hygiene Feedback Report. This shows hand hygiene compliance trend over time. This chart highlights the unit's hand hygiene compliance and total number of observations throughout time. Looking at the chart, we can see the compliance of the unit for each month. At the bottom, where it shows NO, means that there is no observations collected during that month. If instead of NO it displays ISO, this stands for insufficient observations, meaning there is not enough observations for it to display on the chart. You will need at least 25 observations to display on this third page. At the top, we see a line crossing the entire chart. This is referring to the target percentage of compliance. At this time, the current target is 90%, though this may change as the years progress. Just below the chart, we have a table displaying the exact compliance and the total number of observations for each month. When creating a report, you may wish to email, save, or print the report. Scrolling to the top, we can see how to do each of these things. On the top, there is a floppy disk, which is for saving the report. Click the floppy disk and then the file type you wish to pull from. Most useful is the PDF file. From the PDF file, you can print the report. If you wish to send the report as an email, you can click the Send option in the top left of your screen. After selecting the Send button, an email template will pop up. This allows you to enter recipients that you want to send the report to, as well as edit the subject and message heading for the email. To send the email, enter the recipient's email address in the top window. You can add multiple addresses by separating them with a comma. It is good practice when sending reports to email the unit report to yourself. Once you are prepared to send the email, select the Send button at the bottom of the screen. You should now be able to access the Clean Hands portal, generate a unit hand hygiene feedback report, understand how to interpret the unit hand hygiene feedback report, and how to send a Clean Hands report. Congratulations! You've completed Module 7. You are now ready to begin Module 8.